Hello friend, today we are discussing about ECG, or it is also called as electrocardiogram, which detect the heart pulses or heartbeat. Introduction to the ECG. ECG is essential for diagnosis of dysfunctioning of the heart, essentially in the management of cardiac rhythm. Any dysfunctioning of the heart or dysfunctioning of atrial or ventricular contraction is detected in the ECG machine, help in the diagnosis of chest pain. When there is any chest pain, there is a dysfunctioning of the heart, or there is also called as angina pectoris. Proper use of thrombolysis is a treatment of myocardial infarction. MI is depend upon it. MI is also called as a heart attack. History of electrocardiogram. In 1842, Italian scientist Carlo realized that electricity is associated with a heartbeat. In later that 1872, French scientist Gabriel Lippmann invented the capillary electrometer, which can measure electricity by utilizing mercury. In 1876, Irish scientist Mary analyzed the electrical pattern of frog's heart. In 1895, William Enthovin, which is very important for ECG, is credited the invention of EKG, is also called as ECG. In 1906, using the string electrometer EKG, William Enthovin diagnosed some heart problems. In 1924, the Nobel Prize of Physiology and Medicine is given to William Enthovin for the work on EKG or electrocardiogram. Electricity of heart. This is the electrical conduction of heart impulse created by SA node towards the whole heart. Contraction of any muscle is associated with electrical charge called as a depolarization. It is the process of depolarization and repolarization. Depolarization is called as a contraction and repolarization is also called as a relaxation. This change can be detected by the electrodes attached to the surface of the body of the patient, which stimulates or conduct the impulse from heart generated through electrical impulse. Although the heart has 4 chambers and the electrical point having only 2. Wiring diagram of the heart. Conduction is started from SA node to AV node through bundle of phase. The bundle branches to left and right ventricle. This is the conduction of impulse from SA node to the whole heart. There is also the bundle of his Purkinje fiber that embedded in the right or left ventricles, which cause their contraction and relaxation. Shape of ECG. ECG is conduct of 3 waves: P waves, QRX complex or T wave. P wave indicate that contraction of arteria. QRS complex indicate that ventricular depolarization means ventricular contraction, and T wave indicate that ventricular relaxation means ventricular repolarization. This is a normal ECG. P wave, ventricular arterial contraction, QRX complex, ventricular contraction, or T wave, ventricular relaxation. This is a TP segment from T to P. From P to Q there is a PR segment P to R and ST segment from S to T. There is a J joint. Let's take a look particularly to the each wave. P wave. P wave represent arterial depolarization, means arterial contraction. In sinus rhythms, there should be a P wave preceding each QRS complex. PR interval is the start of a P wave to the start of the Q waves. It represents the time taken of electrical activity to move between the arteria and ventricle. QRX complex. After P wave, we are discussing about QRX complex. QRX complex indicate that ventricular contraction, or also called as a depolarization of the ventricles, it is seen three closely related waves on the ECG, Q, R, S waves. ST segment. ST segment start from end of the S wave and finish at the start of T wave. ST segment is a isoelectric line that represents the time between the depolarization and repolarization of the ventricle, means contraction. T waves. T wave represents the ventricular repolarization. It is a small wave after the QRS complex. An RR interval start from peak of one R wave and end at peak of next R wave. This represents the time between the two QRS complexes, means two consecutive ventricular contractions. QT interval. QT interval start from the beginning of the QRS complex and the finish at the end of the T wave. It represents the time taken from ventricle to depolarize and then repolarize. Electrical activity of heart start at sinoatrial node, is also called as SA node, and spread to AV node, atrioventricular node. It then spread down to the bundle of His, which is present in an intraventricular septum, and then to Purkinje fiber to cause ventricular contraction. It is also called as ventricular depolarization. Whenever the contraction of electrical activity is towards a lead, you get a positive deflection in that lead, which is connected to the ECG. Whenever the direction of electrical activity is always from the lead, to get the negative deflection in that lead. Cardiac axis give us an idea of overall direction of electrical activity which is present in ECG machine when ventricular are contracting or relaxing. This is the SA node. This is our heart. This is SA node, which is present in the right atrium that generates impulse that passes to AV node. This is the AV node, and from bundle of His to Purkinje fiber, it passes to left ventricle and right ventricle. This is the conduction of impulse from SA node to the overall heart. From SA node, it is also goes to the left atria, which cause contraction of right and left atria, which cause arterial contraction, and then ventricular contraction, which cause pumping of the heart. So this is for today's lecture. Thank you for watching. Please like and subscribe our channel.